I was one of the 1 in 12 people who had Hep C and didn't know that I had it. So I was dying without knowing it, and I was diagnosed quite by accident.
Hep C's impacted my life. I have Hep C.
Well, I was diagnosed with Hep C almost 2 years ago.
I would say very dramatically, I'm a hepatitis C success story. Yeah.
How does hepatitis C impact our community?
Because it kills people that we care about. Like that's the end game of it, right?
Affects my community specifically is that there's such a stigma attached to it.
I think it's a lot more common than people give it credit for. I think that people have this idea that it is only active IV drug users that have Hep C, which in fact is not the case. There's a huge segment of our community that may be impacted by Hep C, either through friends and family members.
Hep C impacts our community because it touches the lives of some of the people that we love most and care most about. And so it is our job to go out there and spread awareness, to tell people to get tested so they can get treated.
It's a free test, why not come out and get it done, right?
I mean, not knowing that you have hepatitis C is probably the worst situation.
How would you describe stigma associated with hepatitis C?
Well, stigma to me is because somebody at my work just found out recently. And I went into my job, I do food prep and stuff. So I never told anybody there that I had it. They've seen it on my Facebook. Now, I'm just waiting for her to be fired because they can think of a different reason for me taking time off, maybe when my mom was sick or whatever, coming up with that excuse in order to let me go because I work with food. And people are very uneducated, but there's a lot of education out there.
Well, it's not great when I tell people that I've had hepatitis C. The first thing they do is ask me how I got it. They think I'm a needle intravenous drug user. Maybe I am, maybe I'm not. Or maybe I was. Doesn't matter how anybody got it. It's just like cancer.
It causes fear and almost pandemonium in people's hearts, and
Scared to touch, to hug. They need more information.
About something that people are not even aware of what they're afraid of, which is a really dangerous thing.
I think more than anything, people with hepatitis C and the stigma around them frightens people because they don't understand it, and there needs to be more information, there needs to be more education to the general public about hepatitis C, because it's not just needle users, it's not just addicts that get it.
Even on our way down here today, I had some gentlemen stop me on the street and ask us what we were doing and why we were bringing supplies down. And when I explained it to him, he had said, "Oh, well, you should be careful." So I think that's just like a lack of awareness on his part, and it's sad that a lot of people are not aware.
What needs to change in order to eliminate stigma?
I think we need to have events like today where we have awareness-raising events. Hep C is out there. It's something that can be treated. It can be cured. It's not a life sentence. So I think the most important thing is education and awareness.
I think people need to be open to other ideas. People need to get the education that they need, proper education that has accurate information.
A lot of people don't know a lot about the disease itself and that it can be treated, and that's unfortunate because it's a very simple treatment, you know.
A lot of people think that Hep C has a vaccination, but actually it's only hepatitis A and hepatitis B that there's vaccinations for, and there's a lot of misconceptions about people thinking that there's a vaccination for Hep C when there is not.
I think just more awareness that it's not just a dirty drug addict that can catch it. Anyone can get it, right?
People need to know that you can get Hep C tons of different ways, so to have the stigma that everybody with Hep C uses intravenous drugs is just not true.
We need to have more education. We need to inform people as to what Hep C is, how it's transmitted, blood to blood, not touching hands.
People need to be more caring towards one another and stop pushing people away and stigmatizing others. And the more compassionate we are with our healthcare and the more services we bring to the people that need it the most, the more healthier our communities will be.
People are there to support you. We have places like Sanguen and Arch, days like World Hepatitis Day.
Days like this definitely, and other like bigger events of, here, have some information.
We need more days like World Hep C Day. We need more people to be aware of it. We need more people to come out to it. We need our friends and family to come out to it. People that not only have Hep C, but people that have family members, friends, anything, to make sure that they come out to days like this and make sure that their friends know. It lessens the stigma.
Why is harm reduction important?
It means saving our communities, our users.
Preventing of disease, helping people in a safe way, like condoms and clean needles.
Drug users face a whole lot of stuff out there that is inherently risky. So harm reduction to me is anything that means eliminating the risks. It means safer supplies, it means education, it means supporting people that may choose to use.
To reduce harm to yourself, right, and the people around you, right?
Helping the whole community, not just a drug user, it's helping the whole community.
Being non-judgmental, non-stigmatizing, it's about keeping people safe.
Harm reduction means treating people with the dignity that they deserve. Harm reduction also applies to everyone in all different ways. It's not just applicable to drug use.
Harm reduction means to meet people where they're at, not where I think they should be at.
Not treating them like they are a segment of the population that don't need help, because they do, and I just think that everybody deserves to be safe and live a happier and healthier life, no matter what their life choices are.
Whether you agree or disagree with their lifestyle, just giving them the tools in order to stay safe and keep the community safe overall.
It's about community, it's about people, it's housing, it is umbrellas, it is seatbelts, it's glow-in-the-dark condoms,
stop signs,
it's granola bars,
speed limits,
life jackets, it's eating before drinking at the bar, it's a million different things.
Drinking milk.
And milk.
It means that we have compassion. Harm reduction, and it should be spelt compassion. Because these are our brothers and sisters. And they're dying, and we're letting them die. Because we're turning a blind eye because we're afraid. And it's gotta f***ing stop.
Why is outreach important?
There's just so many different things that alcohol and drug use can affect in your life. It's so important to have people, little baskets at all of those angles to catch all of the that falls through the cracks.
There's a lot of support to talk if they're having problems.
Outreach workers are actually out in public where everyone can be seen.
Really just having that face there of like, hey, we do this and we want to talk to you and give you these supplies, and we'll be here next week and the week after that.
Being in tough times in your life, they're always there for like an ear.
It's someone to talk to when you need to hang out and talk to someone.
So you have someone to talk to.
Our outreach team affects are people that will not necessarily come into a healthcare clinic. They don't really want to be part of or are not able to access primary health care.
And if it wasn't for those times, I wouldn't be alive, I don't think.
Couldn't be anything better than outreach. I tell you, they helped me. I'm here because of outreach.
Really just remind people like you're people and you deserve to be happy and all of that. I really like that both the agencies do that.
Outreach is important because that's where I ended up getting a lot of my knowledge, my testing for Hep C, my diagnosis for Hep C.
Outreach meets people where they're at, which I think is really important because a lot of times you can't just expect people to come to you and you have to go to them.
Outreach makes services inclusive and accessible.
And we want people to know that there's a cure, so access treatment. Call our office.
Know your status, get tested, get treated.